आई वुड से मैंने इतने साल लंग पेशेंट्स के साथ काम किया है। सिंस 2007 मैं लंग पेशेंट्स के साथ काम कर रही हूँ। ट्रीटमेंट एक जगह पे रहती है, एजुकेशन एंड सपोर्ट इज एट वन प्लेस, एंड दैट्स द रीजन हमने कैरिंग कॉन्वर्सेशन शुरू किया, विच इज ऑनलाइन सपोर्ट ग्रुप फॉर लंग पेशेंट्स। बहुत बार ऐसे होता है कि बहुत सारे लोगों को खांसी होती है, हम इग्नोर कर देते हैं, बट इट कैन बी अ वार्निंग साइन। एंड बहुत बार ये हमने ये इग्नोर किया है कि ठीक है, थोड़ा शहद ले लेते हैं, कुछ काढ़ा ले लेते हैं, दैट डज द ट्रिक। बट व्हाट इफ दिस कॉफ विच इज टेलिंग यू दैट इट्स समथिंग वेरी सीरियस? सो आज का हमारा जो कैरिंग कॉन्वर्सेशन का सेशन है, द कफ गाइड, व्हाट लंग पेशेंट्स नीड्स टू नो, इज जहां पे हम कुछ मिथ्स है, हम वो बर्स्ट करने वाले हैं। वी आर गोइंग टू डी कोड द सिम्टम्स, एंड मोस्ट इंपॉर्टेंटली हम आज जानने वाले हैं कि अगर खांसी नहीं जाती है तो क्या करना चाहिए, कब डॉक्टर के पास जाना चाहिए, ये भी हम चीज जानने वाले हैं। So our guest speaker is a doctor who is truly understanding the language of lungs, I would say. Dr. Jai Mullerpattan. He's very highly accomplished chest physician. He is from the prestigious St. J.S. Medical College and K.M. Hospital, Mumbai, and इन्होंने further specialization respiratory medicine में किया हुआ है at PD Hinduja National Hospital, Bahim. And I think more than a decade that he's been treating, teaching, and transforming the pulmonary care, I would say, in India. He is an associate consultant at Hinduja Hospital since 2015, and ये काफी सारे complex lung conditions पे काम करते हैं, ILD, TB, COPD, asthma, अलग अलग conditions पे. And he trains the future also of respiratory care by training DNB and MSc students. And he's not just only a consultant, I would say. इन्होंने काफी सारे expert advanced procedures भी किए हुए हैं, जैसे ब्रोंकोस्कोपी है, ईबस है, लंग बायोप्सी है, जिसके वजह से ये लंग पेशेंट्स को काफी हेल्प करते हैं एक्यूरेट डायग्नोसिस एंड राइट ट्रीटमेंट देने में. He is also a fellow member of ERS, European Respiratory Society, and American College of Chest Physician. So, I would say he's getting the abroad knowledge in India also. So, I would like to welcome is Dr. Jai. Dr. Jai, it's a powerhouse of knowledge and experience, I would say. Please, it's a grand welcome to you. Thank you for joining us today for Caring Conversation and all over to you. We are thrilled to have you.
Thank you. Thank you so much, Mrinmay, for having me here. And I think the second time I'm here for with you all, and it's always a great pleasure to be with all of you.
Thank you. So I would just request कि सारे participants आपके अगर questions कुछ रहेंगे, हम end में we will try answering those. आप chat box में अगर उसके दौरान कुछ questions आते हैं तो उसमें डालिएगा, and please stick to the topic. उसके अलावा कुछ चीजें नहीं पूछेगा. All over to you, Dr. Jai.
So thank you. We'll be just having a brief overview about cough and what are the types of cough and what patients can do about them, how we treat it, and then I'd be happy to take any further questions from people. So
Sure. So we have put you on spotlight. I think your PowerPoint should also be. Just one request ki Hindi and English mix is what we would like to request you to speak in.
Okay, so my slides are mostly in English, but I will try and speak in bit in Hindi.
That's perfectly fine.
Okay.
Yes, it's visible all over to you.
Okay, so we'll just start it with, so what is cough? So cough, basically it's a protective reflex. So I know it's a very irritating symptom, but it is mainly a protective reflex which has been formed to protect our lungs from any foreign body or something that has entered in the respiratory tract. यानी हम जब कुछ खा रहे हैं या बाहर से कुछ अंदर जो नहीं जाना चाहिए अंदर जाता है, तो उसे बाहर निकालने के लिए जो खांसी है उसका उपयोग शरीर करता है. So that is the main function of cough. So it's a protective reflex, and it is caused by an explosive expiration against a closed glottis that promotes movement of lower respiratory secretions towards the mouth. So जो अंदर कफ जमा है उसे बाहर निकालने में मदद करता है. So what are the types and etiology? So based on duration, we call cough as acute when it is less than 2 weeks, subacute between 2 to 8 weeks, and chronic cough which is more than 8 weeks. So what really troubles, what we are more worried about is when the cough is between subacute to chronic phases. That's when we are a little more worried, because most self-limiting causes of cough, यानी जो वायरल इन्फेक्शन है या सिंपल इन्फेक्शन है, तो वो आपका, या सर्दी खांसी नॉर्मल जो होती है, वो 1-2 हफ्ते में आपकी खांसी निकल जानी चाहिए. बट जब खांसी 2 से 8 हफ्तों से ज़्यादा चलती है, जिसको हम सब एक्यूट या क्रॉनिक कॉफ कहते हैं, तब हमें थोड़ी चिंता होती है कि कोई कुछ और अंदर चल रहा है क्या, जिसकी वजह से ये खांसी है. आर वी डीलिंग विद समथिंग क्रॉनिक लाइक टीबी? Are we dealing with bronchitis, ILD, lung fibrosis? Are we dealing with asthma? Or could it be something like lung cancer? Many of these things come up in our mind once we know that the cough is not settling in the expected time period. Then based on expectoration, it could be either प्रोडक्टिव, वेयर जहाँ बलगम आता है उसको हम प्रोडक्टिव कॉफ कहते हैं, या जो एकदम जो सूखी खांसी होती है वो उसको नॉन प्रोडक्टिव या ड्राई कॉफ बोलते हैं. Okay, then based on the character of the cough, you can classify it as bovine cough when you have recurrent laryngeal nerve paralysis, especially if you have, like, say, an enlarged thyroid, or suppose a lung tumor, etc., which is compressing on the nerves that supply the vocal cord. You will get a bovine kind of cough. You will get a brassy cough, where mainly you have tracheal involvement or narrowing with tracheomalacia, और extraluminal compression of the trachea, that is your main breathing tube. Whooping cough, जिसे हम काली खांसी कहते हैं, और pertussis. Then you have a barking cough in croup, which is mostly seen बच्चों में जो दिखता है वो. And prolonged wheezy cough with asthma. Paroxysmal non productive cough, mainly अगर आपने कुछ इनहेल कर लिया, यानी कोई आग आग के पास जो धुआं आता है वो अंदर चलता जाता है, या कोई एकदम स्ट्रॉन्ग सेंट अंदर जाता है, या कुछ फॉरेन बॉडी अंदर जाती है, उसमें पैरोक्सिस्मल और सूखी खांसी आती है. और एक बबली कॉफ होता है जहाँ पे बहुत सारा कफ अंदर जमा होता है, जैसे कि ब्रोंकाइटिस में या ब्रोंकिक्टिसिस में होता है, या कभी कभी जब निमोनिया होता है तो ये बबली कॉफ आ सकता है. So this is mainly for medical people, not so much for importance for us. Basically, this just tells how the body controls the cough and what are the places where the cough receptors are there, which includes airways, lung tissues. You have the feedback going to the brain, and there is a feedback loop which triggers muscle movements and causes the cough. Okay. सो व्हाट आर द इटियोलॉजीज? तो कॉफ के कारण क्या होते हैं? तो ये बहुत सारे कारण हो सकते हैं खांसी के, इसलिए कारण जाना बहुत इंपॉर्टेंट है. वी नीड टू नो व्हाई देयर इज अ कॉफ, so that will help us in diagnosing and then treating the patient and relieving, because unless we treat the root cause, the cough is not going to go away. So most important is acute cough. You have infections where you have upper respiratory tract infections or laryngitis, pneumonias, where you get, your normal cough, cold, sore throat, the viral infections. These are the ones which cause an acute cough. Chronic cough could be TB, fungal infections, bronchiectasis. These infectious causes to cause chronic cough, जो 8 हफ्तों से ज़्यादा चलता है. Then you can have cancers such as lung cancer, lymphoma, other tumors. You can have interstitial diseases such as lung fibrosis, in ILD, etc. Then you have breathing tract difficulties such as asthma, which is most common, COPD, which generally occurs, what we are commonly known as emphysema and bronchiectasis, occurs most commonly in smokers. जो बीड़ी सिगरेट पीते हैं उनमें ज्यादा होता है, बट आजकल बिकॉज ऑफ द पोल्यूशन एक्सेट्रा, नॉन स्मोकर्स में भी सीओपीडी बहुत ज्यादा प्रमाण में देख रहे हैं. बाकी ब्रोंकिक्टिसिस एंड पल्मोनरी इओसिनोफिलिक सिंड्रोम्स. एसिडिटी जो होती है उससे भी बहुत ज्यादा लोगों में खांसी हो सकती है। जो खांसी है वो एसिड जो है वो कभी कभी पेट से आपके फूड पाइप से ऊपर आके जो वोकल कॉर्ड है उसको इरिटेट कर सकता है और वहां से खांसी हो सकती है। और इसलिए ये जिनको एसिडिटी होती है जब वो लेट जाते हैं स्पेशली खाने के तुरंत बाद, ऐसे लोगों को एसिडिटी की वजह से खांसी हो सकती है। हार्ट फेलियर से बहुत बार खांसी होती है, तो अर्ली हार्ट फेलियर जो एकदम फ्रैंक नहीं होगा, अर्ली हार्ट फेलियर में एक्चुअली खांसी से शुरुआत होगी और फिर आगे जाके सांस फूलेगी एक्सेट्रा। और दूसरा रेयर कॉजेज है, कुछ दवाइयों की वजह से खांसी हो सकती है, या कभी कभी सिर्फ स्ट्रेस या साइकोजेनिक कॉफ बोलते हैं, एंजाइटी है, उसकी वजह से भी खांसी हो सकती है। सो सर्टन associated symptoms give a clue to the etiology of the cough. So you have basically acute cough with upper respiratory tract infection, जिसमें पोस्ट नेजल ड्रिप होता है, साइनस सिम्टम्स होते हैं, गला बैठ जाता है, छींक आती है। ये सब में आप जनरली अपर जो वायरल इन्फेक्शन होता है उससे वैसी खांसी होती है। दूसरी, अगर आपको एक्यूट खांसी हो गई है जिसके साथ हाई ग्रेड बुखार है, पीला कलर का बलगम आता है, कभी कभी चेस्ट पेन हो सकता है, सांस फूल सकती है, तो निमोनिया या लोअर रेस्पिरेटरी ट्रैक्ट इन्फेक्शन हो सकता है। खांसी जो बहुत बार खाना खाने के बाद होता है और लेटने पे होता है, जो हम बोलते हैं लाइंग डाउन आफ्टर मील्स, जो अगर हार्ट जो छाती में जलन होती है तो उसको हम GERD या गैस्ट्रोइसोफेजियल रिफ्लक्स डिजीज कहते हैं, जो कॉमन लैंग्वेज में हम उसको एसिडिटी रिलेटेड कॉफ बोलेंगे। दूसरा, जो अपने कंट्री में वी हैव द लार्जेस्ट पॉपुलेशन ऑफ TB पेशेंट्स इन द वर्ल्ड, so we have to be careful about not missing that disease, and it is one of the biggest infectious causes of death in our country. So cough more than 2 हफ्ते से ज्यादा खांसी होगी, रात को पसीना आएगा, कभी कभी ब्लड आएगा, बुखार आएगा, वजन कम होगा, ये सब अगर सिम्टम्स साथ में होंगे तो TB होने की शक्यता ज्यादा होती है। और इसमें आपको आपके डॉक्टर को मिलके एक्सरे या कुछ करके और फिर आपको आपका कफ का जांच करके आप डायग्नोस कर सकते हैं। आप अगर आपका कोई रीजन से आपकी इम्यूनिटी कम हो, यानी आप सपोज स्टीरॉइड ले रहे हैं या आपको HIV है, कैंसर है, एक्सेट्रा, डायबिटीज है, तो दूसरे जो नॉर्मल लोगों में नहीं होता है वो टाइप ऑफ इन्फेक्शन ऐसे लोगों में हो सकता है, जैसे कुछ फंगल इन्फेक्शन हो गया, नोकार्डिया इन्फेक्शन हो गया। तो ये रेयर इन्फेक्शंस है, बट सिर्फ उनमें होता है जिनमें इम्यूनिटी कम होती है। दूसरा, जो ये स्मोकर्स होते हैं, दोज हु आर स्मोकर्स, दे कैन गेट व्हाट वी कॉल इज COPD और क्रॉनिक ब्रोंकाइटिस। दे कैन हैव क्रॉनिक प्रोडक्टिव स्प्यूटम on most days of the month for more than 3 consecutive months for more than 2 years. तो अगर साल में 3 महीने आपको कंटिन्यूस खांसी है और ये 2-3 साल तक चल रहा है, तो आप कह सकते हैं कि आपको ब्रोंकाइटिस है। और फिर आप शायद आपके डॉक्टर को मिलके वो लंग फंक्शन टेस्ट करके शायद आपको इनहेलर या कुछ शुरू कर सकते हैं। और अगर आप स्मोकिंग कर रहे हैं तो आपको तुरंत स्मोकिंग बंद करनी चाहिए। क्रॉनिक कॉफ विथ कोपियस फाउल स्मेलिंग प्यूरिलेंट स्प्यूटम, यानी अगर रोज रोज आपको बहुत सारा कफ निकलता है जिसकी गंदी स्मेल आती है, जो पीला कलर का होता है और जो एक पोजीशन में ज्यादा निकलता है, तो उसे हम ब्रोंकेक्टेसिस कहते हैं, जहाँ पे लंग्स के अंदर छेद हो जाते हैं और वहां पे कफ बार बार जमा होके इन्फेक्ट होता है और ये रोज निकलते रहता है। फिर अगर आपका लॉन्ग स्टैंडिंग कॉफ है, यानी बहुत दिनों से खांसी है जो सूखी रहती है और धीरे धीरे आपका सांस भी फूल रही है और आपके जो नेल्स हैं वो भी थोड़ा सूज रहे हैं, तो उसको हम इडियोपैथिक पल्मोनरी फाइब्रोसिस बोलते हैं, जो एक इम्पॉर्टेंट कॉज है खांसी के लिए। और कभी कभी रीसेंट ऑनसेट कॉफ विथ चेंज इन द कैरेक्टर ऑफ द कॉफ, अगर एल्डरली में है जिनको स्मोकिंग भी कर रहे थे और खून भी आता है, तो उनमें आपको लंग कैंसर का आपको डर बैठता है, तो आपको जांच करानी पड़ती है। और नाइट का जो खांसी मोस्ट लाइकली नाइट में होती है, यानी रात में होती है, लेटने पे होती है, तो उसमें एस्थमा है, पल्मोनरी एओसिनोफिलिया है, हार्ट फेलियर है, एसिडिटी है, तो ये सब कॉजेज मोर कॉमन नाइट कॉफ के लिए होते हैं। So just with the combination of symptoms that you have, your doctor can probably guess that what kind of what is likely diagnosis of your cough, and then he can investigate you in that certain direction to confirm the diagnosis and also treat you accordingly. So all cases of chronic cough are recommended to be tested with at least chest X-ray and other tests like spirometry, PFTs, 2D echo, CT scan. So as and when whatever test is needed, your doctor will advise you. Always see your doctor. Don't go and get your test done on your own blindly, because you might not know what that test report is saying, whether it is significant, not significant. It might just cause you anxiety. So meet your doctor or a pulmonologist. They will guide you and explain you why a test is needed and what the results mean, so that you are actually aware of your condition rather than just going and doing. Because in our country, you can probably just walk into a CT scan center, get a CT scan done or get a PFT done. But then if anything small, non-specific is mentioned in that, you will probably get stressed and get anxious. So avoid that and always go through your doctor. So infection, allergy, and vasomotor rhinitis can increase normal nasal and nasopharyngeal secretions that trickle down to the hypopharynx and larynx, where it irritates cough receptors. So this causes what is called as very often as a post-nasal drip. So the symptoms are frequent throat clearing, sneezing, rhinorrhea. Very often you could have sinus headache, sinus tenderness, excess secretions in the nasal cavity, inflamed and edematous nasal mucosa, and the cobblestone appearance of the back of the throat. So this, your ENT can have a look at it and then guide you whether this is actually a post-nasal drip or is it anything else. So GERD we had just spoken about, where there is a reflux of the contents of the stomach into the food pipe or the esophagus and the throat, and it can stimulate the cough receptors there. Aspiration of gastric content into the lower airways can cause a chemical bronchitis and possibly pneumonitis as well. Retrosternal burnings after meals or on lying down, hoarseness, bitter taste in mouth are the usual symptoms. And inflammation of the glottic inflammation or the larynx can be detected on laryngoscopy. And the diagnostic test is a 24-hour esophageal probe, where it's a probe placed in your food pipe just above the stomach, and it monitors your pH there throughout the 24 hours. Ideally, it should be less greater than 7, but if it goes below 7, means that some amount of acid from the stomach is going into your food pipe. Then, sorry, कॉफ वेरिएंट अस्थमा, वेयर सो अस्थमा जनरली में, अस्थमा में क्या होता है, सांस सांस फूलती है, छाती में से सीटी बजती है और खांसी भी हो सकती है. बट कुछ लोगों में सांस बिल्कुल नहीं फूलती, बट सिर्फ खांसी होती है. बट ये लोग को आप जब पंप देते हैं या इनहेलर देते हैं तो उनको इम्प्रूवमेंट आती है. तो ऐसे लोगों को हम कहते हैं कॉफ वेरिएंट अस्थमा. सो उससे भी खांसी हो सकती है. एस इनहिबिटर, सो ये क्लास ऑफ ड्रग्स है जो हार्ट फेलियर और ब्लड प्रेशर के लिए बहुत यूज होता है. वन ऑफ द एग्जांपल्स इज रैमिप्रिल, जो कार्डियोलॉजिस्ट बहुत ऑफन देते हैं. लिजिनोप्रिल, रैमिप्रिल, ये टाइप के ड्रग्स. और almost 1/3 of these patients can get cough. And if you do get a cough after starting this medicine, you have to meet your doctor. He will immediately change it to something safer. And even after stopping, it can take about 2 to 4 weeks for the cough to completely settle. And chronic eosinophilic bronchitis is characterized by chronic cough with greater eosinophils in the sputum and without any airflow obstruction. So PFT test is normal, but there is greater amount of eosinophils in your sputum. So what is the treatment? Once, okay, you have got a cough now, so what do you do about it? So the treatment of cough basically is post-nasal drip. It depends on the treatment of the cause. So if your cause is so post-nasal drip, therapy depends on presumed etiology and may include antihistamines, nasal decongestants, antibiotics or anticholinergics. GERD, as I said, acidity would involve eating dietary changes, avoid very spicy food, elevation of head and torso during sleep, avoiding sleeping immediately for 1 to 2 hours after meals, and using antacids. And cough variant asthma typically responds well to inhalers. Antitussives or cough suppressants are used for symptomatic treatment of cough associated with variety of conditions, but they should be generally used only for dry cough. If you have a wet cough, यहाँ बलगम निकलता है, so these kinds of treatment should not be used. If you have a dry cough which is very irritating or debilitating, disturbing your sleep, then of course you can use these medications. Very few of these are approved by FDA since data regarding their efficacy and safety is limited, and they are classified as centrally acting, where they may act in the brain, such as morphine, codeine, etc., or peripherally acting, which is such as benzonate, which is a local anesthetic which kind of cools down the pulmonary stretch receptors and reduces the cough. You have levodopa, which is used in many cough syrups, and that can also modulate your C fibers in your respiratory tracts. Guaifenesin, and then you have other medications such as gabapentin, which can be started at a low dose, but this all should be done only under medical supervision. Don't try all of this on your own. Other cough therapies include mucolytics. So this, when we come to प्रोडक्टिव कफ, जहां बलगम निकलता है, तो वहां पे हम ये कफ सप्रेसेंट नहीं दे सकते, हम वो सप्रेस देते, वो दवाई देते हैं जिससे कफ आराम से इजीली निकल सकता है, बिकॉज वेरी ऑफन द स्प्यूटम बिकम्स वेरी थिक, बलगम बहुत गाढ़ा हो जाता है, तो हम बहुत जोर से खांस के भी वो निकाल नहीं सकते. सो ये दवाइयाँ जो है वो बलगम को थोड़ा पतला करती हैं, तो आप आराम से उसे निकाल सकते हैं. So mucolytics such as N-acetylcysteine, acebrophylline, ambroxol, and expectorants such as guaifenesin, which are usually used in combination with bronchodilators. Other methods, of course, pulmonary rehab, which I think Dr. Mrinmay must have spoken to you about, yoga. You have other devices which are especially used in airway diseases with secretions like acapella and aerobica. What these devices do is they produce vibrations that, due to the resistance, that loosen the secretions and make it easier to cough out. तो ये एक डिवाइस में आप फूंकते हैं और उससे जो वाइब्रेशन अंदर जाती है उससे कफ छूट जाता है और वो से बाहर निकालना आसान हो जाता है. So treatment, the other treatments of cough. So over-the-counter cough remedies can help in many ways. So as we know, suppressants are supposed to lessen your urge to cough. Expectorants thin the mucus and make it easier to hack it up. If you have a wet cough, you need to bring that mucus up from your lungs. So it's not recommended to use a suppressant unless you're desperate to get some rest. Instead, it is best to use a mucolytic or an expectorant. Be careful when choosing an over-the-counter cough medicine, because some people shouldn't take them. They can interact with some prescriptions and may also cause problems if your age is older than 60, if you have asthma, high blood pressure, glaucoma, enlarged prostate. So certain of these medications can interact in these conditions. So speak with your doctor or pharmacist before buying just a random cough syrup, because you don't want other complications because of a simple cough syrup. Avoid triggers. If you have allergies or asthma, try to remove allergens from your house, such as keeping pets out of your bedroom, using air conditioners or air filters during the pollen seasons. You won't see the effects right away, but if you stay away from what bothers you, you should start feeling better. If you smoke, talk to your doctor about different ways to try to stop smoking. And treatment for another problem. So especially if your cough is caused by a medical problem such as asthma, acid reflux, COPD, heart failure, you may need to change your treatment plan for the illness before your cough will improve. For example, people with acid reflux stop coughing once they start taking medications that stop the reflux, and talk to your doctor about how you can manage your cough. So home remedies for cough. So there are some things that you can try at home to just ease your wounds. थोड़ा गर्म पानी या सूप वैसा ले सकते हैं. थोड़ा पानी ज्यादा पीजिए ताकि आप ड्राई नहीं हो, हाइड्रेटेड रहें. Gargle with salt water if you have a sore throat. Sleep with your head and chest elevated. That can help with your reflux, help in heart failure, help in post-nasal drip, etc. Try cough drops if your cough throat is irritated, and moisturize the air you breathe with either a vaporizer or a humidifier. You could also run a hot shower in a closed bathroom and breathe in the air. how to stop a tickly cough instantly. So sometimes the cough is just too irritating, and especially in certain professions, say you're going for an interview or you're a teacher or you're giving a speech and you don't want the cough to constantly bother you. Sometimes you can have a cough that seems to be triggered by a tickling feeling in your throat. It can be very annoying and the cough can trigger irritation, which leads to more coughing. So you can just place your hand over your mouth as long as you feel the tickle or you think you will cough. So you can swallow one time, keep your hand over your mouth and hold your breath for a few seconds. Take slow, smooth breaths for the next 30 seconds. Tell yourself that you're not going to cough. Breathe in normally. Take your hand away from the mouth and repeat as needed. It may not always work, but very often it could just, avoid you from coughing. When to contact your doctor about your cough. So this is very important for all of you. Sometimes a cough is more serious than just a cough. Okay. So if you experience any of these, please note that it could be an emergency and contact your doctor immediately or go to a hospital. If you feel like you're choking, if you have breathing difficulty, if there is blood when you cough, if you have severe chest pain as well as a cough, although the next signs might not be a medical emergency, they could be signs of a serious illness. If you don't have any of these, contact your doctor as soon as possible to see what you should do. So if you do have any of these, so if your cough is not going away, as I said, 2 से 8 हफ्तों के ऊपर अगर खांसी गई है तो फिर don't try and just use home remedies. Go and see your doctor because there is some underlying problem as well which is causing the cough and you'll need specialized treatment. You start whistling, which is a whistling sound. If that happens, you're probably having some asthma or emphysema and you need to see your doctor. If you have a fever for more than 1 or 2 days along with a cough, definitely see your doctor. And if you need, if you're bringing out येलो और ग्रीन स्प्यूटम और म्यूकस पीला बलगम आता है तो शायद आपको एंटीबायोटिक की जरूरत रहेगी तो आप डॉक्टर से मिलिए. So everyone has a cough now and then, but if your cough is producing phlegm or mucus, don't try to stop it with a suppressant. That stuff needs to come out of your lung. If you have a dry cough caused by an irritation or an allergy, you need to do some detective work to see what's going on to avoid it. So if you know what is irritating you, like some people are allergic to nuts, some people may be to certain perfumes or dust or smoke, etc., then you need to avoid that. A cough can also be a sign of something serious. So if your cough continues or gets worse for more than 2 to 4 weeks, please see your doctor. So certain questions that are very often asked, what is the best medicine for a cough? So there is no one best medicine for a cough. You may want to take a suppressant to stop the cough if you have a dry cough, or you really just need some sleep and you're not getting sleep at night, or you may need an expectorant to thin out the mucus so that you can cough it out easily. Can I stop? How can I cough stopping so much? So as we already mentioned, you can try drinking warm water, breathe in warm, moist air and sleeping with your head elevated. How do I know whether coughing is serious? जैसे we have already discussed, अगर छाती में सीटी भी बजती है, सांस फूलती है, छाती में दर्द होता है, बुखार आता है, खांसी में खून आता है या पीला या ब्राउन कलर का, ग्रीन कलर का बलगम आता है, तो आपको कुछ सीरियस हो सकता है, तो आप तुरंत अपने डॉक्टर से मिलिए. What does a bronchitic cough sound like? A bronchitic cough is often wet cough because you need to bring up mucus from your airway, but it can also be dry cough that causes whistling or wheezing. So I'll stop here. So just put out certain points based on this, or if any other questions people have regarding their cough, I would be happy to answer you.
Thank you, Dr. Jai. I think so. You have covered mostly everything.